There are three operations that we perform, and these are the three operations that are done the majority of the time in this country and really in the world. The three operations include the lap band, the sleeve gastrectomy, and the gastric bypass surgery. So the lap band, which this is exactly the band that we use, is an inflatable cuff on the inside of a silicone ring connected by tubing to a little port. And what we do is we put this band around the upper portion of the stomach, just below the top of the stomach, centering on this very sensitive area of our stomach. This model is very accurate in terms of the shape of the stomach, although smaller than our actual stomach. So when we put the band around the top of the stomach and we tighten the band appropriately and the band compresses the stomach, what we get is an effect where the band causes hunger and portion control. Those are really our objectives that we want to achieve when we place the band and fit it properly for the patient. So what happens is we use a band, we don't change the anatomy of our stomachs at all, and this has been very reassuring to patients. A lot want the least aggressive approach to achieve their weight loss. They don't want to change their anatomy at all. They want something that's reversible. Well, the band achieves that very well, and that's what's unique about the band. So we place the band around the upper portion of the stomach. We achieve a certain compression that's appropriate for the individual, and once we achieve that compression, we get our objective of portion and hunger control. Now, the band does that very well. The band doesn't choose your foods for you, it doesn't take you out walking, and the band is really very dependent, like any surgery, on a patient's involvement in the process. If we get this hunger and portion control, and the patient is involved in the process by doing the appropriate exercise and eating the appropriate types of foods, we get our expected outcome, which is where someone will lose at least half of their initial overweight. When someone loses their overweight, what we can expect is a healthier and more active person that typically will at least reduce their risk for future medical conditions or need fewer medications that they currently take, and certainly someone who can take advantage of more in life and be more active. Second operation is the gastric bypass surgery. The gastric bypass surgery I like to think of as the most aggressive approach. It's aggressive in that what we do is we divide the stomach near the top. We divide the stomach about where we would have put the band, just below what we call the gastroesophageal junction. We completely divide this area away from the rest of the remainder of the stomach, which we don't have to remove. The rest of the stomach remains in place. And that's one of the most frequently asked questions. What do we do and what happens to the rest of the stomach? We leave it in place. The rest of the stomach actually still functions. After we divide the top portion away from the rest, we make a new connection with your intestine to this portion of your small stomach. And what that achieves is significant portion control. When someone eats, all they have to do is fill up this very sensitive area of your stomach. The food then goes from here into your intestine, bypassing the rest of the stomach. That's how we get the name. Bypassing this area, and that becomes a very powerful, has a very powerful effect on weight loss and also on certain medical conditions. It really gives us the most weight loss compared to the other operations. And it's also probably the most powerful operation for some medical conditions, especially diabetes. So if someone comes in that's significantly overweight, or someone comes in that has a lot of medications, and especially with diabetes, that's what I would probably recommend for them. A third operation that we do is called the sleeve gastrectomy. Unlike the band, is not reversible because we do remove a portion of the stomach. And unlike the gastric bypass, it doesn't bypass any area of your stomach, and the flow of the food naturally goes at the way it would go right now. So it has certain advantages over the lap band, and it has certain advantages over the gastric bypass, and it's really intermediate in how aggressive it is for the patient and intermediate in the weight loss results. When people are considering weight loss surgery, I think we can tailor an operation specifically to the individual based on what their comfort level is. So what I try to do is, in speaking to the individual, is try to figure out, number one, how aggressive we need to be based on their starting weight, based on their starting medical conditions. I try to figure out what their comfort level is in terms of whether they want an operation that is completely reversible or whether they're comfortable with an operation where we do remove a portion of the stomach, for example. All right? So with the band, for example, someone might come to me and say, you know, I just can't accept an operation that's irreversible. I want to fall back and feel a certain level of comfort that if there's reason to reverse this, that we can do that. And that certainly is an advantage of the lap band. There are other people who don't want a device, which is what we're dependent on. We're dependent on a band that sits around the stomach, potentially for the long term. And there's some people that are just not comfortable with having a device that's inside of them. And for these people, we have options that include the sleeve gastrectomy and the gastric bypass surgery. There are some people who I might advise being more aggressive with because they're significantly overweight, because they have more medical conditions, because they're on more medications. And if that's the case, I'd probably steer them to either the sleeve gastrectomy or the gastric bypass surgery. And then we just figure out with the individual what is right for them. Right now, the sleeve gastrectomy happens to be the most popular operation because it's intermediate in how aggressive it is between the lap band and the gastric bypass surgery. So really, to break it down and summarize how to choose one of the three options, I like to consider that each operation has their unique advantage, each operation has their unique limitation, and then we try to choose the one that's right for the individual. And again, to summarize, the unique advantage of the lap band is that it's a reversible operation. It's something that we can remove, and the stomach anatomy goes back to its original state. But its limitation is that the weight loss tends to be less statistically over time. And another limitation is that we are dependent on a foreign body or device to achieve this. The gastric bypass, its unique advantage is that it's the most aggressive operation, and it's very powerful for certain medical conditions that we want to do our best at resolving. Unique limitation is that it's not reversible. We've changed the anatomy of your stomach. We've changed the way the flow of your nutrition flows through your body. There's potential, actually, because of that, for some vitamin deficiencies that can occur. And then if we think about our third option, the sleeve gastrectomy, where we remove a portion of the stomach, where we remove the expandable portion out here, unique advantage is that we're not dependent on a device, we're not rerouting the flow of the nutrition, but of course its limitation or disadvantage, just like the gastric bypass, is that it's not reversible. If we remove a portion of the stomach, we can't get that back. That's an irreversible process. All of these procedures are performed laparoscopically, which means they're all done with very small incisions, with very precise instruments, and fiber optic visualization. What that means is that recovery is actually quite quick. Recovery is a matter of days to maybe a week for any one of these operations, and really that's because of the low impact of laparoscopic surgery on a patient's body. We don't make a large incision like we used to in the old days, decades ago. We make very small incisions, either 5 to 10 millimeters in size, and we can accomplish all these things with all of these operations through these really tiny incisions, which means less pain and really very quick recovery. Depending on the type of operation that someone has, recovery time can be from a matter of days to a week or two. The band, the gentlest operation, least aggressive, recovery is just in a few days. Almost all people get back to work in under a week. The sleeve gastrectomy recovery is about a week, but it depends in part on how physical their job is. Gastric bypass, more aggressive operation, recovery is about a week or two. With any surgical procedure, there is the potential for surgical complications. With the gastric bypass, there's potential for leak, bleeding, and long-term possibility of vitamin deficiencies. The potential complications for a sleeve gastrectomy are leak and bleeding. The potential complications for the band, number one, would be a possibility of erosion. Number two, slippage of the device. And number three, the device fails. And what I mean by that, the band can develop a hole in the tubing, in the port, or even in the cuff. And if that were to occur, we just have to replace one of those components. A patient who has weight loss surgery can expect dramatic, life-changing results. Depending on the procedure they have, they can lose half to up to 3/4 of their initial overweight. We expect their medical conditions that they have, like diabetes, high blood pressure, sleep apnea, pain, heartburn, we expect these to be significantly improved and often resolved entirely. So when lifestyle changes are combined with this powerful tool that surgery provides, we expect patients who are healthier, live longer, have more energy, and an absolutely better quality of life.